Hello everybody, I am Dr. Senthil Kamalasekeran, Senior Consultant Orthopaedic Surgeon at Lotus Speciality Clinic. In our previous video, I had described about shoulder stiffness, and today I am going to go about showing you some simple stretches and exercises to get relief from your symptoms and from the pain. The first exercise is arm stretches. In this, you stand vertically and place your arms across your chest and give it some resistance using your other hand. You will feel a tight pull in the back of your shoulder, and this says that you're doing your exercise right. Repeat the exercise on either sides, holding each stretch for around about 2 to 3 seconds. By doing this for around about 10 reps on either side, you will get good stretch on your shoulders. The same stretches can be performed by doing it against the corner of the wall. Go to the corner of the wall, place your arms on either side of the wall at the corner, and lean against the wall with your body weight. By doing this, you can feel a tight stretch on the front of your chest wall, and that is because of a relaxation on the tight anterior capsule. The capsule is a structure which holds the joint in position, and when it gets tight, the pain starts and the movements get restricted. Our aim by doing these stretches and exercise is to stretch the capsule and get range of movement. To improve the range of movement, I'm going to show you some exercises. For this, I'm going to use the help of a stick. Using a stick, I can show you all the ranges of movements. The first movement is forward flexion. Using the stick, trace an arc in a forward fashion and bring it down. Hold it in the air for 2 seconds. This is forward flexion. Now, using the stick, trace an arc on either side and bring your arms to touch your ears. This movement is abduction. Hold it each time for approximately 2 seconds and repeat it for around 10 reps on either side. Take the stick and keep it at the back. Hold it with one arm and pull it upwards. This movement is internal rotation, and this is the movement which is lost first in stiffness of the shoulder. Repeat it on the opposite side. Now hold the stick at the nape of your buttock and extend your arms. This movement stretches the subscapularis muscle. Place the stick against your nape of your neck and stretch out, feeling the stretch on your front of the shoulder. When you have shoulder stiffness, the first movement which is lost is internal rotation. By loss of internal rotation, I mean that you are unable to reach out and touch your back. To stretch this capsule which is tight, normally we stretch the muscles and the capsule in the front of the shoulder. This can be done by many ways, either by using a weight like a dumbbell, or you can have a TheraBand. So what I normally do is I sit against the couch, hold the dumbbell. You can either use a 2 kg or 3 kg dumbbell, and using that, I place my elbow flat against the couch and raise it in an upward fashion so that it reaches 90 degrees or slightly more. By doing this, I place enormous stretch on the front of the capsule and loosen the structures and helps the shoulder gain range of motion. The same exercise can be performed in a lying down manner. In your house, if you do not have any dumbbell, you can always use a 1 liter bottle which can be frozen and taken out from the fridge. Using a TheraBand or an exercise band, we can easily do internal and external rotation movements. For this, use the TheraBand or exercise band against the door handle. Hold it with your hand and keep your elbows tucked against your chest wall. And using the resistance of the band, you bring it either inwards for internal rotation or outwards for external rotation, and you can feel a stretch against your capsule, and you get good stretching for internal and external rotation. I hope these exercises have helped you, but however, if you continue to have any symptoms, please visit your orthopedic surgeon or see a physiotherapist to get further advice. Thanks.